Ryan, thank you so very much. We could be on the verge of gaining another weapon in the fight against COVID. Pharmaceutical company Merck says it has developed a pill to treat the virus. Clinical trials show it appears to work on COVID variants as well, reducing the risk of hospitalization or death in half. Merck officials say it will ask the FDA for emergency use authorization soon. To better understand this, we bring in Dr. Salim Surani joining us live to discuss the COVID pill. Dr. Surani, with the Matrix and the coming up in December, I can't help but think red pill, blue pill. How does this pill work? What do you know about it so far?
Good morning, John. Glad to be here. I think as we have discussed earlier that, we have a lot of things, which has emerged in our armamentarium, but I think if we can find some pill, which is like a Tamiflu, so in case even either you get a breakthrough infection or you get an infection with non-vaccinated, and you take the pill that can decrease the hospitalization and severe illness, just like Tamiflu. And there were three pills, one by Pfizer, one by Merck, and one by Roche. The molnupiravir, which is by the Merck, has kind of, looked at the data, and they were thinking of coming a little later. And they found the data so promising that the Data Monitoring Board actually cut the trial in short. And that was a very significant improvement. It decreases the hospitalization by 50%, which is a big number because most of the medicines which you use, it can cut down by 5%, 10%. 50% is a big number. The other thing which is very powerful was that there were 8 deaths in the placebo group, whereas there was no death in the patients who were taking the pill, which is the molnupiravir. So I think that's a very, very positive news. And plus, we still have 2 more drugs on the pipeline, which should be having some data in the very near future. So hopefully we can have more than one options.
Dr. Surani, this is an antiviral pill. So how does that work? What's the efficacy behind it? I mean, I know you mentioned right now there were 8 deaths in the placebo group and none for those who received this pill. But how does it stop the replication process?
So it is like an antiviral medication. It prevents the replication of the RNA. So I think that's one of the key factors. If the virus cannot replicate, they're in big trouble, and then they can be eliminated by the body immunity very quickly. So that's one of the good thing. One of the side effect which they were kind of, concerned always when they use this is there is any transmission to the fetus or any problem with the pregnancy. So the pregnant patients were not included in the trial, but they had done this study in the animal model and they did not see any of those side effects, which is a good thing. So anytime you do the trial, you always want to make sure you exclude the pregnant woman. Once the drug is found to be safe, then based on the animal study, they extend the trial. So far, very positive news. We just have to see the complete data, and more than likely it will go through the FDA emergency use authorization. One of the things I feel that will happen is that they will probably have only non-vaccinated people approval and ideally it can be used for vaccinated breakthrough, but the trial did not include really too many of those patients.
And you said it is similar to Tamiflu. Dr. Surani, we're going to continue this conversation in the next half hour. We appreciate your time as always. So if you're sitting at home, you're on the couch and you're having a cup of coffee or maybe a donut and you're wondering, what did Dr. Surani just say about that COVID pill? Send us a text to 361-855-6397. We'll be sure to answer all your questions as soon as we can.